Hello friends, welcome to BMH Learning. This video deals with hormone replacement therapy. HRT simply means a therapy where hormones are replaced. It's basically a medication that contains female hormones. So, you take the medication to replace the estrogen and progesterone that your body stops making during menopause. Now the principle. So, as you begin to transition into menopause, your ovaries no longer produce high levels of estrogen and progesterone. That is, changes in these hormone levels can cause uncomfortable menopausal symptoms including hot flashes, night sweats or cold flashes, vaginal dryness, urinary urgency, insomnia, mood swings, mild depression or irritability, dry skin, dry eyes or dry mouth. So, hormone therapy is used to boost your hormone levels and relieve these symptoms. Now remember, HRT is not for everyone. So, you should not use HRT if you think that you are pregnant, have problems with vaginal bleeding, have had certain kinds of cancers, have had a stroke or heart attack, have had blood clots, or have liver disease. This was all. Thanks for watching.